Hey there, Dr. Gord here. So, old school versus new school approaches to how we diagnose and treat back pain is going to walk you through how you can shift your thinking and approach so you can finally get out of pain and return to a normal life. So, what you're going to learn in this short video is a traditional approach to treating back pain, or what we call old school approaches. And we're going to touch on why we think certain back problems just don't get better. Finally, we're going to pull the curtain back a little bit and show you how old school versus new school clinical approaches might be the answer you've been looking for. So let's get started. So the three most common causes of chronic back pain, meaning how did you get here? In the business, we call this mechanisms of injury. So the first one is where high amounts of force are involved, like trauma. Examples include, motor vehicle accidents, work injuries, sports injuries, or if you slip and fall. The second way you can injure your back is more what we call repetitive strain injuries. And these typically amount from things that are involved in our lifestyle and posture, where low amounts of force are experienced, but they're done so frequently that they build slowly over time to finally damage the back tissues. Examples include what I'm doing right now, sitting in front of a desk or a computer, poor postures, sedentary activities. Other examples include repetitive movements, where we're always moving in the same direction. The tasks we do during our normal days, we're bending over constantly, and those cumulative effects build over time until finally your back gives a time out and says, we just can't do this anymore. The third category, and probably more commonly, is a combination of numbers one and two, where we had maybe some trauma in our past. We slipped or fell back in the day, or we were involved in an accident, or we grew up playing sports and had a bit of a misspent youth. Those injuries healed fine, but unfortunately, then our lifestyle takes over and we get involved in some repetitive strain activities that continue to aggravate the original injury. So, how do we traditionally approach back pain? Let's just discuss what we call the old school model. It's based on what we call a structural diagnosis, and that's basically where we try and figure out what tissue or tissues have been injured or damaged that are creating pain. It's based on our original understanding of pain, which is traditionally what we call a bottom-up model, meaning the damaged tissue generates a pain signal, and that pain signal travels up to the brain. Brain was considered basically the receiver of that pain signal, and because pain is our danger warning system, the brain has to kind of react to that signal that's coming in and create a response. So typically what the response that's created is it invokes what we call our fight or flight mechanism. So let's go back and kind of look at this. The logic goes something like this. If we can identify what tissue or tissues are painful, which is called diagnosing the pain generator, then we can organize some sort of treatment aimed at helping those painful tissues heal. So the idea is if we can get those painful tissues to heal, the pain will stop. So how is that? Did that work? Well, sometimes it does. Like basically, if the answer is yes, so we organize some sort of treatment that stopped the pain, well, life becomes good again. Unfortunately, how that's worked, research has showed that this maybe helps about 20% of people that have back pain. So kind of dismal stats on that one. So the other thing is basically, did it work? Well, no, it didn't. Unfortunately, for about 80% of the people experiencing back pain, that traditional approach just didn't work. And so then the structural diagnosis models means we got to go back to the drawing board. So what does that mean? Well, going back to the drawing board means we, double down on trying to identify the painful structures or what tissues are generating the pain. So we order tests like X-rays, MRIs, CAT scans, and other tests. The idea, again, if we can get better tests, then maybe that will help us diagnose the pain generator. And if we can better diagnose the pain generator, we can organize different treatments to address that pain generator, and then the pain will stop and life becomes good again. So treatments that are often stem from this become more interventional, things like injections. You might be referred to a chronic pain program. You might even be recommended to go visit a surgeon. Unfortunately, all too often, though, patients are told that they need to learn to live with it. So if we look at our stats, basically, how has that structural diagnosis treatment worked? Well, unfortunately, like I said, the outcomes are pretty poor. 80% of the population tends to get back pain. 25 to 40% at any given time have back pain. And if you've had back pain, between 5 and 20% of people never recover. They go on to develop chronic pain. In fact, this problem is so significant now. The World Health Organization has identified it as spinal pain is now considered the #1 cause of disability in the world. So, unfortunately, if you're one of these people that has continued to experience pain despite best efforts to try and help you out, you might be feeling a little bit depressed right now. Well, have faith because we're going to start to pull the curtain back on what we call the new school thinking. Okay. So, in order to understand new school thinking, we had to look at this the why. Why do people continue to have pain that long after an injury? We know that the body is designed to heal. Sports medicine got on this train a long time ago where they identified three specific phases in how our bodies heal. Phase one is what we call the inflammation stage. That typically happens from ground zero when you first get injured up to about 72 hours later. Your tissues, the damaged tissues, are inflamed. Then what happens is our immune system sort of starts to kick in and repair the damaged tissue. This happens on autopilot. We don't have to consciously think about this. Our army moves in and begins to remove the damaged tissue and repair it with new tissue. It's magic. We also know that the time frames on this, when you go through phase two, depending on how badly the damage was, can wrap up in within about 8 to 12 weeks of the initial injury, so 2 to 3 months. Then you kind of move on to phase three, which is called the regeneration phase. This is basically where that repaired tissue is reorganized to better deal with the stresses and strains life throws at that new tissue. And again, this happens within that 8 to 12 weeks, but the reality is it can keep going on. Our bodies are constantly reshaping themselves to better cope with the stresses and strains. But the bottom line is there seems to be this disconnect where tissues heal, like within 2 or 3 months, we're pretty confident that the original injury has healed, but the pain continues. So why is this? How can that be? So the new school thinking evolved out of trying to answer that question, where we now combine the original structural diagnosis model, but we add what we call a functional diagnosis. And the functional diagnosis is all about trying to figure out why do those tissues continue to cause pain after they've healed. More importantly, we try and identify what underlying dysfunction continues to strain the tissue or tissues so that they remain painful. The other important thing is we've really evolved our understanding of pain. Modern pain science, some of the biggest and best, brightest brains in pain scientists have changed our thinking and our understanding of pain. So the back pain action plan, the course that we're putting together for you, is meant to shift your thinking and approach, basically from the old school over to the new school thinking. The modules are put together where we walk you through some structural diagnosis, but then we also add in functional diagnosis, and then we layer on top of that modern pain science. Basically, if we combine those three things, we'll walk you through from old school versus new school, trying to shift your thinking and approach to get out of pain and finally get back to returning to a normal life.